We are now joined by Roger Halliday from Data Research Scotland, who's going to be telling us all about how to compete in the data analytics space. Now, we all know we're competing for resources, talent, etc., and it can be increasingly very difficult for those perhaps not in the sexiest of industries, and I'm thinking those tech companies that some of us are not within. And he's going to tell us some secrets about how to keep the talent and attraction into all industries. So, Roger, welcome to the stage.
Thanks very much, Catherine, and hello, everyone. So as Catherine said, I'm Roger Halliday. I'm currently the Chief Executive of Research Data Scotland, and previously to that, since 2011, I've been the Scottish Government's Chief Statistician. And that's a time of significant realization about the power of data. And I've been responsible for growing the statistics profession in the Scottish Government from 120 to 250 people. And I was the Chief Data Officer in Scottish Government from 2017 up to the COVID pandemic, where we had to bring a whole range of skills around data together, where we were in a situation where we couldn't compete for talent on pay, and we had to compete in other things. So I'll kind of reflect a bit on those things, and I'm likely also to touch upon my time leading the Scottish Government's COVID analysis team during the pandemic and how we brought teams together. And I suppose finally, because I've just started recently in Research Data Scotland, a charity aiming to improve well-being by enabling access to data and connecting that data around a person, place, or business, and how we've grown the team here in Research Data Scotland. So I want to say probably something about why I think people join the public sector, why they stay, and how we can collaborate around data, and how we can create great careers and opportunities for people to save time, money, and lives with data. So in terms of the kind of motivations that people have, and the things that I hear, so these are sort of 4 stories from people that have started over the last couple of years. So Anushka came into Scottish Government with physics and astrophysics as a degree, and never really thought about careers in analytics. But when we had people visiting the university and talking to her about careers in government analytics, was attracted to making a difference with using the skill set that she had. And I think that's probably what I hear the most is that phrase, I want to make a difference with the skills that I've got. But Lisa, she came with a psychology degree. And also, she'd never thought about careers in analytics, but when she spoke to some of the statisticians that we had, said she was really attracted by the kind of high-profile nature of the work, the fact that she would maybe working on something during the day that would be used on television when she went home that night, or her friends would actually be talking about something that she was working on. And then Kirsty was an interesting person to work with, because she didn't come straight from university into an analytical career. She'd started her own company. She did a whole range of stuff around wildlife conservation at university, and she really wanted that variety in career to be able to create her own career path, but using some of the analytical and research skills that she'd got. And then John, again, he'd come through a clinical and health psychology background, and really was motivated by working on data and evidence and promotion of an understanding of equalities related information to make the world a fairer and more equal place. And with all of these people, while they're all doing careers in analytics, in government and in the public sector, none of them have come with that kind of degree. They've all had a numerate degree, but actually the pool that we're looking for in analytics, and the same is true in the wider data space, is making sure that we're sometimes going to the places where we don't immediately think of, and actually there's a lot of talent out there. And in terms of people's motivations, well, actually, we know that creating the conditions for data-driven innovation can have massive benefits. And so these are the sort of things that we talk about when we're recruiting. And these figures are for Scotland, a country of 5.5 million people. So clearly, if you're thinking about UK or thinking about the sort of bigger countries, that the impact that we can have as individuals working in government, working in the public sector, to improve the lives of people, to create jobs, and improve the environment is really significant. Now, when I started in Scottish government, 2011, and we kind of had a model here of, and this is definitely true, not just for statistics, but for analytics more broadly. We'd look at the kind of needs of politicians or of some of our colleagues in the civil service, operational leaders in the NHS or in local government, assess, how can analytics make a difference? We tend to then go and collect some data about that. We'd spend quite a lot of time on the collection of the data, actually, and then maybe have a little bit of time left over to do some analytics on that, to bring some insight to that. And then we'd spend quite a bit of time on communicating. There's a big emphasis on open government and making sure that the statistics or the research that we were working is published and shared widely. But actually, go into a university and recruitment fair. What do people actually want to do? Well, the majority of people want to bring insight to the world, create new understanding, and therefore lead to new things happening. And I suppose also want to be able to tell people about it, do data visualization, lots of interesting work there. But actually, lots of the work that we were doing was spent on the data collection. So a significant thing that we now have spent time on is automation in the public sector. Think about the whole pipeline from the needs to the publication and data sharing. So often now we don't just go out and collect data, we assemble data, we bring it in from other places, and then put it around a person, place, or business. We spend more time proportionally on insight, and then we make sure that we talk to people about it. But what that means is that we've got time to solve problems, and that we can start using lots of interesting techniques to do that. We can very much work with others to do that. So I think getting out there and just making sure that the reality of the work that we offer in public bodies actually fits the narrative that the people we know that we want to hire, they'll come here and they'll stay here because they've got roles that help us solve problems, bring insight, and help communicate what they do. So just talk about a couple of examples of that. So one of the jobs that I had was at the Department of Health in England, and the challenge here was that we had a significant number of people who had really really poor health. They were using a lot of different kinds of health services. The quality of life wasn't great at all. And kind of wondered, well, actually, could we do something upstream here to try and avoid that situation? And so because we actually found that something like 5% of people that go into hospital account for the majority of spend of the NHS. And this is a quite a small number, about 400,000 people across England. And so we kind of started working with the GPs, because GPs are going to know people and who are the people over the next year that are likely to need the most treatment. And it turns out that actually GPs aren't that great at predicting who these people are. They got those people right about a third of the time. So I was kind of brought in to say, actually, could we use data and people's histories to do that? And then when we did that, when we sort of brought together the times that people had been into hospital before in different forms, well, actually, we could. So we could get that right about 2/3 of the time. But then we kind of recognized that if we could train up GPs to use a bit of their intuition, knowledge of the of patients, together with the power of data, that we could really make a big difference. And actually, when you train up GPs and get them using this data, that they're able to predict who these people would be 75% of the time, 3/4 of the time. And why does that matter? Well, the difference between predicting 75% of the time and a third of the time means that you can put in preventative services. It means that people live longer, they have higher quality of life, there's a significant saving to the NHS. And what this also did was identify new groups of people that perhaps were kind of were overlooked in terms of the treatment that they get, particularly people with significant mental health problems. So new care was coming in for people that were saving time, money, and lives. For example, that we had was around health and homelessness. So we've been collecting data on homelessness for many years, 20 years, and the numbers would go up, numbers would go down, and actually we'd not actually done much more with the data than that. But what we did was organise our own data, put those 20 years together, and you saw that unfortunately 400,000 people in Scotland had been homeless at one time or another. That's 8% of the population, massive number, really shocking number. So what can we do about it? That's a big number. Can we do anything about it? Could we predict who these people might be, and could we improve the services for them if they become homeless? Well, yeah, it turns out we can do both things, because linking that homelessness data with data from the NHS and from other places allowed us to investigate what are the barriers to homeless people accessing healthcare. And it turns out there are quite a lot of barriers, and the health and well-being of people homeless is really terrible. So that allowed the NHS to put in services to particularly preventative services for people that are homeless that really had a positive impact. What this work also did was identify some of the predictors of whether you're becoming homeless. So losing a job would be one. If you suffered domestic abuse would be one. Presenting in a GP for mental health or alcohol or drugs problems is another. And so thinking about what we did all that analytics in conjunction with some of our colleagues in Glasgow University. But that was all great analytics, which is why it's below this line here. But actually working with people in frontline NHS, with local government, was able to actually take that in and think about, well, how might we operationalize this? Well, it turns out that you can operationalize it by going to the GPs, and if you present for alcohol, drugs, or mental health problems, further questions can unlock some of the significant risk factors for homelessness, and then you get some tailored support for you. And it turns out that it does prevent you from being homeless, or it's much more likely to prevent you from being homeless, and it's much more likely for other changes, positive changes in your life, such as finding work, and all of that has a significant benefit to the Exchequer too. So this is sort of lots of recent stories of where working in public sector analytics has really made a difference. And then I think COVID is a perfect example of this, where the kind of stories that I would tell leading the COVID analytical team to ministers, to First Minister, to the Cabinet, were the stories that would then go out to the media, that would become the public stories. And so really seeing the work that I would be doing during the day immediately playing out in terms of the media narrative, in terms of the public narrative. And these are the kind of opportunities that we get working in the public sector. And so I think the keys, therefore, for me to recruitment of people are sort of number one, working upstream. So we've got lots of great data in the public sector. We can make that non-disclosive lots of the time. So lots of our data is used in university courses, and so that gives people a view on what difference that we can actually make. What's the kind of interesting insights that you can get from careers in the public sector. Lots of our statisticians and Scottish Government analysts, other public sector analysts are visible in courses for the kind of target groups that we're going for, sort of whether it's setting challenges, judging challenges, or speaking, doing guest lectures, or whatever it might be. That visibility has been quite important, actually, as well as doing some of the more traditional things like providing summer placements or doing internships. And like I said earlier on, having that wider view of where to look for talent. It's certainly less than half of our graduates are for statistics in government in Scotland have a maths, statistics, or computing background. We draw a lot of people from natural sciences, psychology, social science research, and train people up. And that we also make sure that we have people out there that can tell a good story, that are relatable to the audiences that we want to draw in, and making sure that the population that we're drawing upon as wide a pool of people as possible that represents the population of Scotland, and that ultimately it comes down to, are we offering high profile and interesting roles, and that's the principal thing that we trade on, and I think there's a good story for us to tell there, because this is sort of, I suppose my experience is working in a whole range of areas, both in analytics, in government policy, in data-related events, running surveys. Like I ran the GP patient survey for England, which is a survey of 5 million people. I put together the GDP figures for Scotland's first ever quarterly GDP figures. Ran a review of post-16 education in Scotland, and a range of other rather interesting posts. Probably isn't a part of the public sector that I haven't touched, and that's not too uncommon for people that have spent careers in government and in the public sector. You do get a whole wide variety of opportunities there. Then when it comes to retaining staff, what we have, and I think we're pretty good at retaining staff, is to have upfront and as part of your recruitment, but have a clear learning offer that that spans a number of years, and we certainly have that. We have an induction program and a range of kind of leadership through a menu of analysis, professional learning, non-professional learning. We have a sort of clear support program for people. We have a mentor and a buddy for people when they're new to work, when they're new to the organization, when they're new to the public sector. And the opportunities for developing careers, like I was describing of my own career, are really quite typical. That you have quite wide networks of analysts across public bodies, where you can find out what other people do and then move around, and that's encouraged. Well, yeah, very much so. And the final thing I would say here is that we also work. A lot of people work in very small organisations. Scottish Government, like I said, we've got a couple of hundred statisticians there, but many people in the public sector work in data and analytics teams of sort of 4, 6, that sort of number. And as well as developing those networks of people, we've had a lot of people moving to and fro across public bodies, is creating the space where collaboration between different organizations can happen. And that really helps people not feel isolated. People feel part of that public sector analyst community. And that allows people to see potential moves and see places for their career to develop. We have programs like an analytical exchange program where we support third sector organizations doing voluntary work for a couple of weeks to build connections, both with the analysts that are working on it across organizations, but also working with the third sector as well, and building consultancy skills. And we have programs like the Data Science Accelerator program, where we have we give people a mentor. They work for 3 months on a specific project and build their data science skills. So, for example, on the 3 here, the census, the work to look at, could we use natural language processing to code up lots of the responses that come into the census. Turns out, yes, we can, and we can save quite a lot of money in doing so. The Care Inspectorate there that would go and inspect sort of social care in Scotland have looked at how could they bring together a whole range of data to predict areas where they should target their inspections, both qualitative, quantitative data, reviews, all sorts of things, and now they've sort of moved forward with that. And we've got a Scottish crop map where we're using satellite data to replace surveys of farmers in showing the crops that are grown across Scotland in order to understand the supply of different things coming through. So yeah, there's lots of opportunities here in analytics, and in fact, more broadly in Scotland, there's a lot of investment in data-driven innovation, and these are just some of the organisations here. And there's we're in a space where there's a lot of collaboration across these organisations, a lot of joint working, and therefore the ability to move and progress people's careers between these different organisations. And well, that's exactly what I've done in setting up and now being the chief executive of Research Data Scotland. And like I said right at the beginning, we're here to promote and advance health and social well-being in Scotland by enabling access, bringing together a whole range of public sector data about people, places, and businesses, allowing it to be connected, and improving access to that in two ways. One's just doing that data organization, and then providing a service for researchers to get at that data quickly and easily, whilst maintaining the trustworthiness that the public sees in us. And we've got now a whole range of information together to allow a whole range of insight to happen. And so there's examples that I mentioned about high intensity users of hospital services or of health and homeless nurse that great examples, and there are a number of these, but we should be doing that systematically across the public sector. And really from that diagram I was showing earlier on about making insight the thing that will spend their time doing rather than data collection. Our Research Data Scotland's there to do the data assembly for people so that they can do the insight. And this is going to put us in a really good place, I think, sort of, I guess, internationally, but also in terms of what we can do for government. So just to finish off with a particular project that we're working on here, which is that in the COVID pandemic, it was pretty clear that the data that we had on equalities kind of wasn't up to the challenge of us understanding how COVID was playing out across different parts of society. And so, there's the range of things that we're doing to address that. But one of the things is to provide or make the most of the data that we have so far. So we've got some equalities data from the census in 2011, though it's a little bit out of date. But then again, lots of people's characteristics doesn't change too much over time. We've got some data from schools, we've got data from the health service, and we've got some other data as well. And we're bringing that together into an equalities research data set. The idea is then that provides much better coverage of all our protected characteristics in ways that are entirely de-identified and held extremely securely. But what it allows then is other public sector organizations to bring along their data, to connect it in to the data on equalities, and provide insight into the extent to which access to their services, outcomes from their services are fair, and then allows them to create more inclusive services. And I think that's some of the power of the data. And to go back to what one of our new statisticians, John, was saying, he was there to really provide great insight and understanding and promote equalities. Well, this is how we're making that a reality. And I think ultimately that's what we're about, is about creating the careers where you can really make a difference with your career, that you have high profile statistics that are the discussions around the dinner table, that are the things that you see on television, that offer varied careers and ultimately make lives better and play to the motivations of our analysts coming forward. And I think there's a lot of people out there that feel that way, and that's the pool that we're looking for through careers that ultimately save time, money, and lives with data. Thank you.
Absolutely incredible, Roger. Thank you so much for presenting on that. Now, unfortunately, we are out of time for questions, but to the audience, I would implore you, please go and connect with Roger on LinkedIn, follow Data Research Scotland's journey. It's certainly been an interesting one. And if you want to dive a little bit deeper as well, we do also have a podcast together, so you can check that out at the Business of Data /podcast as well. But Roger, thank you so much for your time.
Brilliant. No, thank you, Catherine.